okay. So hello dears and welcome to the continuation of our pre-recorded lecture in our class in your Didactics, no? And still under clinical parasitology, and I think this is the third part and the last part na yun, hopefully, of our discussion on your Sporozoa. Okay, so ang last nato na discuss sa last video was of course your Plasmodium, no? So major bulk yun of our lecture was centered on that, no? As it should din naman kasi 'di ba, malaria is the leading parasitic disease worldwide, no? Siya talaga ang pinaka-star ng Pasko at siya ang pinaka-important, ganun. So, ayun. So, as it should, no? Munang siya ang bulk, major bulk yun of our lecture in this pre-recorded lecture, no? So, we're done with Plasmodium, di ba? Recall, at mga species, no? P. falciparum infects all stages of your RBCs, di ba? So, siya ang gina-consider as your F-boy. Charot. Mga, may place ka ba? Charot. Joke lang, ganung level. Tapos, mga mahilig sa mga atabs, mga bata, mga senior high, charot. May mga kilala ka ba? May mga kilala ba kayo dyan? Meron ako. Charot, joke lang. Undangin na ha. Charot. Again, kasi itong mga ganahan rog reticulocytes or mga immature young RBCs, you have P. vivax and P. ovale, diba? Ovata. And of course, katong mga ganahan rog mga gores, no? Mga yan, gusto nila yung mga matatanda. Yes naman, para practical tayo. Charot. You have P. malari. Okay, now we continue with your Sporozoa. Now, again, starting first with your Babesia. Now, your Babesia, actually, it's quite similar lang with your Plasmodium. It was first discovered in the 1800s, and it was considered to be the causative agent of your Texas cattle fever. Okay, and this is transmitted by your ticks. Ayan, so mga ticks dyan. Okay, alright. Two primary pathogens are your Babesia microti and Babesia divergens. So, Babesia divergens causes the more severe, more fatal form of the disease. Okay? So, between the two species, ang Babesia divergens ang medyo makakosog intense na disease. Okay? Now, Babesia species in itself, daghan silang species. Okay? It's not only affecting humans, but also other mammals, other animals. Okay? But the main pathogens lang yun and main species that affect man are your Babesia microti and Babesia divergens. Okay, all right. So it causes again your Texas cattle fever, also known as your red water fever, also known as your tick fever, Nantucket fever, or also splenic fever. Ayan. So Texas cattle fever because it was first found out to infect your cattle, no? And then red water fever because it causes hemolysis in your cattle. Ayan. So sa urine sa mga cattle or sa animals, red ilahang urine. So munang red water fever. Okay? So don't forget ha, red water fever, Babesia. Black water fever, kinsa kanito? Bago na itong na-mention sa previous lecture, you have Plasmodium falciparum. Black fever lang, black fever, kinsa man to? Kinsa man to makakos sa black fever? You have, nako, natapos na sa flagellates. You have, pakipause ang video, dapat na-answer na. Okay? Dapat, unsa to answer, you have Leishmania donovani. Okay? Pero kisa man ito mga cause og Redman syndrome. Hala, Redman's syndrome. Dili na ni siya parasite or dili na ni siya organism ang nag-cause ani. It's a sequelae, no? It's a complication of a drug. Kinsa man tong Redman syndrome? Clean chem ninyo, kamusta na? Okay, malapit ng kompre. Okay, Redman syndrome? Of course, your vancomycin. Please take note. Okay? Vancomycin causes Redman syndrome. Okay? Redman syndrome. So, don't forget sa mga color ha? You have again, kung red water fever, Babesia species. Okay? You have black water fever. Litong pahumot. Charot. Funny ka, Mark. Charot, joke yan. Your black water fever, Plasmodium falciparum. You have black fever lang. You have Leishmania donovani. And then next, you have Redman syndrome. Na ako nang na-erase. Oh my gosh. You have vancomycin. Okay, don't forget that. Alright, okay. So that's for the other names of your Babesia. Di ba, nalimot ko mention. Change outfit tayo ngayon, dears. Ganun. Different day na ako siya gi-record. So, bagong outfit. I hope you like my outfit. My get up. Charot lang. Okay. Alright. Now, vector, of course, it's transmitted by your ticks. No? So, similar Japan with Plasmodium, it's transmitted through your ticks. No? Through an arthropod. Okay. And for Babesia, it's your ticks. Ixodes or Ixodes spp. Ayan. So, here's an example of your tick, Ixodes species. Definitive host is, again, the ticks. And your intermediate host can be us, man, or other mammals. Okay? Alright. Reservoir host, again, for B. divergens, catos, and rabbits. For Babesia microti, it's your white-footed mouse or your Peromyscus leucopus. Okay? So, for man, kita usually accidental rata na ma-host. Okay. Ayan. Mode of transmission, primary good is through the bite of the vector, which is your tick. Or, again, pwede siya ma-transmit through blood transfusion. Okay. Alright, sige. Now, infective stage, similar pa din with your Plasmodium, your sporozoites. Okay. Now, man, kita, we're only accidental. Okay. So, ma-transmit ra siya nato if accidentally mabite sa mga ticks. Okay. Because supposed to be, ang i-bite sa mga ticks are your other mammals, no, or kaning white-footed mouse. Okay. But kita, accidental ang atong transmission. Okay. Alright, ayan. Sige. Now, for the life cycle and morphology, again, life cycle of your Babesia, similar siya with Plasmodium. The difference lang is your Babesia doesn't exhibit exoerythrocytic cycle or your pre-erythrocytic cycle in the liver. Okay? So, ang imuhang Babesia, once the sporozoites are injected into the host, no, into the bloodstream of the host, the sporozoites immediately infect the RBCs. Okay? So, dili sila moagi pag liver. Di siya pareha sa imuhang Plasmodium, di ba? Na moagi pa sa liver, di ba? And kinsa itong duha ka species na naay dormant stage sa liver, na quiescent stage na pwedeng ma-reactivate after how many years? Sa yung duha ka species, you have P. vivax and P. ovale pa rin. And this stage is known as hypnozoids. Sana naman. Okay, alright. Ayan, sige. So, similar life cycle lang. The difference is wala siya exoerythrocytic cycle or moagi sa liver. Di siya moagi sa liver. Okay. As I've mentioned again, once musulod ang sporozoites sa bloodstream, mo-attack na siya dahil sa RBCs and then the trophozoites develop within the RBCs. They may resemble the ring forms of your P. falciparum. And because of that, no, pwede siyang ma-misidentify. But we can differentiate, no, by three major characteristics of Babesia. Your Babesia doesn't have the malarial pigment or your hemozoin, as we have mentioned. It doesn't, the trophozoite also doesn't grow, no, parehas sa imuhang Plasmodium na mo increase in size and it increases the space that it occupies in the RBC. So, dili mo change ang imuhang Babesia na trophozoite. And lastly, of course, ang pinaka-evident na imuhang difference is, of course, a vector. Ang imong Babesia is using your ticks, whereas for Plasmodium, of course, the Anopheles mosquito. Okay. Alright. Ayan. The trophozoite in humans continue to develop into your merozoites. Okay. Sige. Alright. So, we continue for the life cycle morphology. Now, inside the human body, no, once it affects the RBCs, they form this characteristic merozoites, no, and these merozoites are arranged into what we call a Maltese cross appearance, diba? Maltese cross appearance, ayan, as you can see. So these are merozoites or the trophozoites that are attached, no, together by their chromatin dot. So kabante mo ni mga dots, that's the chromatin dot and nag-abot sila. Okay? And they resemble your Maltese cross. So inani ang Maltese cross. Okay? Alright. So basta ni mga Maltese cross nako. So if ang case study or question sa exam kay there is a Maltese cross appearance seen inside the RBCs, nako, press the buzzer, wala nang iba. Huwag na mag-isip. Sino yan? Si Babesia. Okay, alright, ayan. Now, the merozoites, again, they mature and develop into gametocytes sa intermediate host, sa animals na host, but for humans, usually, dili na siya mo form of gametocytes. No? Kutob na siya aning merozoites. Okay? For humans. But for other animals, like your catos, your rabbits, mo develop siya into gametocytes. Diba? As we have already known sa atong mga life cycle, after sa merozoites, usually, the merozoites can become gametocytes. But for sa humans, if ang Babesia na anato, dili na siya mo-develop further into gametocytes. Okay. Alright. Ayan. Now, in the human host, again, the merozoites will just continue to divide, binary fission, to produce more sporozoites. Okay? So, once daghan na ang sporozoites inside the RBCs, ilang i-rupture ang RBCs, and then mugawas ang sporozoites, again, then infecting more RBCs, and then creating more merozoites. Okay? Pero di na siya mo-produce o gametocytes. Okay? Dito na sa animal host ma-produce ang gametocytes. Okay? Alright. Ayan. So, again, please take note, Maltese cross, diagnostic na appearance, no, in your blood films, in your RBCs in a patient infected with Babesia species. But again, it's not always na makita ni siya. Alright? Pero if makita ni siya, then very diagnostic, press the buzzer for Babesia. Okay? Alright. So, Maltese cross sa parasitology, it's Babesia. Pero kung AUBF, Maltese cross formation, or Maltese cross appearance under polarizing microscope or microscopy, kinsa ni na crystals. AUBF natin, polarizing microscopy, no? Maltese cross appearance, kinsa na crystals, you have your cholesterol. Sana naman, na-remember pa. Okay? Cholesterol crystals will form Maltese cross appearance under polarizing microscopy. Okay? Please take note of that. More to come, no, sa AUBF. Okay? Alright, ayan. Sige. Now, life cycle, as you can see, kanina sa red, muna siya ang original, normal na life cycle sa Babesia. As you can see, again, white-footed mouse or your other mammals, sila gyud ang original na definitive host. Okay? Intermediate host. Alright? But for humans, as you can see, accidental lang ta. Again, either through the bite of the tick, okay? Or pwedeng blood transfusion. Pwede po. Okay? But again, generally, dapat wala tayo labot sa yung life cycle. Okay? So, accidental rata. Alright, okay. So, kada mga accidental lang ma-fall. Charot. I-push good anyway. Alright, now we go na to the disease. Ayan. Now, Babesiosis is the disease. Again, other name, tick fever, Nantucket fever, because Nantucket is parang a place in America that's common. Na common siya na disease. So, Nantucket, no, tick fever, splenic fever, di ba? Ayan. Alright. Now, typical patient presenting with babesiosis na expose siya 1 to 4 weeks before ni gawas ang symptoms. So, 1 to 4 weeks ang imuhang incubation before mo gawas ang symptoms. Okay. Now, self-limiting usually infection if the patient is immunocompetent pa rin. Okay? But again, as mentioned sa uban atong parasites, if immunocompromised na, then mas mo-worsen ang symptoms. Okay. Onset, if the patient becomes symptomatic, is usually na fever, headache, chills, arthralgia, myalgia, fatigue, and weakness. So, quite same din sa plasmodium or sa malaria na non-specific. Kung mild disease, influenza-like, pero kung severe, it can mimic your malaria, especially sa P. falciparum, na intense good ang symptoms. Okay. Hepatosplenomegaly, so increase both imong liver and spleen, and hemolytic anemia because again of lysis of RBCs, di ba? If daghan ng sporozoids inside, pwede siyang na-record siya. It could happen also. But again, as I've mentioned, the symptoms tend to be worse if the patient is immunocompromised and if wala na siya spleen. Because again, di ba, recall sa may purpose sa imuhang spleen, di ba? Its purpose is to phagocytose mga old RBCs, no? Senescent RBCs, ayan, di ba? So, if ever wala kay spleen, so in a way, dili makatabang ang spleen or walay mo tabang og remove sa imong mga parasitized RBCs. So possible na mas mumpadayon og daghan ng RBCs. So if splenectomized ang patient, wala na siya spleen or immunocompromised, and of course the symptoms tend to be worsen. Okay, or tend to be severe. All right. Okay. Ayan. Now, also not uncommon, or it's common to see a patient exhibiting or having both diseases, not only Babesia but also the other tick-borne diseases such as Lyme disease and or human granulocytic ehrlichiosis. Ayun na, recall bakte ito. Okay? So Lyme disease and your human granulocytic ehrlichiosis are not caused by parasites, of course. They're caused by bacteria. So recall, na-remember po ba sa MP37 mga last part na to sa lecture? Ito ni mga not common kayo na mga bacteria, you have silang mga rickettsia. Ayan. So, rickettsia, organism, and spirochete. So, Lyme disease, kinsa may nakakos aning Lyme disease? Nako, dapat paki-pause ang video dapat tapos i-answer nyo. Kinsa may makakos sa Lyme disease? It's a spirochete, and kinsa man to? Dapat, alam ng answer. Atong answer kay si Borrelia. Ayan. Burgdorferi. The major causative agent of your Lyme disease. And if you can remember, Lyme disease is of course transmitted by the bite of your ticks. Okay, ayan. So, possible na the tick contains both Babesia and Borrelia at the same time. So, it could give it to the patient. Example po sa human granulocytic ehrlichiosis, this is caused by mga Ehrlichia species, which is again a parasite of the Rickettsiaceae na family. Okay? Now, Borrelia burgdorferi, di ba? Usa tong characteristic rash na yung ma-form. Characteristic rash na ma-form sa Lyme disease, you have unsa ganito? Nako, dapat alam na. Your bullseye rash. Nako talaga, bullseye rash. That's for Lyme disease. So, yung appearance kay na ay inner na red and then ay outer na medyo reddish pod. Bakit parang ang pangit ang drawing ko? Basta ganun, okay? Bullseye rash. Basta bullseye rash, Borrelia burgdorferi, Lyme disease. Pero kinsa man tong bullseye colonies. Nako. Bullseye colonies sa CIN or Cephsulodin ergazan novobiocin agar. Kinsa man to? Bullseye colonies on CIN. Nako, press the buzzer. Atong answer kay Yersinia enterocolitica or pwedeng Euromonas. Okay, nako. Woo! Sana naman, na-remember pa. But anyway, ayan. So, because again, Babesia, Lyme disease, ehrlichiosis, etc., etc., other diseases po, they are transmitted by ticks. So, possible po at the same time makuha siya sa patient, not only Babesia, but pwede pong Lyme disease or ehrlichiosis, di ba? So, not only one, not only two, but three, o di ba? Ang dami mga souvenirs. Ang dami promo, mga packages, ganun. Okay. Ayan, that's for Babesiosis. Okay. Now, for diagnosis, of course, peripheral blood films, no, to visualize, no, the characteristic merozoites, Maltese cross, no, and there's no recommended timing of blood collection. Di siya para sa Plasmodium na it's best to collect, again, malaria, don't forget this, it's best to collect blood samples between paroxysms. Okay, so between the stages na nice symptoms gibati ang patient, nag-fever, gana, because it's during sa paroxysms na daghan ang parasites na makita sa blood. That's for malaria. So, na timing, no? It's best to collect, again, when? Between paroxysms. Okay, but for Babesia, wala ra siya timing, no? No recommended timing of collection. Okay, sorry, excuse me. Parasitemia may be low, so if under mga hematology analyzers, automated analyzers, pwede siyang dili makita. Okay, kay low parasitemia, pwede na siyang ma-miss. Okay, now serologic tests, there could be cross-reactivity with your other Plasmodium species, so it's recommended that you dilute the sample to 1:64. Muna siya recommended para to prevent cross-reactivity. Antibodies to B. microti will appear about 2 weeks after symptoms and may persist for many years. Okay, indirect immunofluorescent test is the recommended serologic method and is useful in the diagnosis of chronic infection. And fourfold rise in titer, of course, between the acute sera and the convalescent or katong naayo na sera indicates recent infections. If na fourfold rise sa titer. Example, if sa serum sa imuhang acute phase kay na kay 1:2, ang imong titer kay 1:8. Okay? And then pag after sa convalescent na ay 1:2, pila man na 64, basta katong mas mataas, okay, fourfold increase, then that could indicate a recent infection. And molecular methods is PCR, which is considered to be the gold standard test for the detection of your Babesia. Okay, now in the Philippines, we have ticks, no, but usually sa humans medyo rare, dili kay common sa Philippines ang Babesia, but in animals, no, there have been studies na medyo common siya because na may mga ticks, okay, mga ticks sa animals. Okay, so may mga studies, Philippine studies, that have found that some of our animals, mga dogs, mga cattos, have also mga Babesia species. Okay, not microti or divergence, mga other Babesia species. Okay, so naman tayo ticks diri pod sa Philippines. Okay, but for human infections na Babesiosis, wala kaayo. Okay, dili kayo siya reported. Okay, all right, so that's for Babesia. Don't forget lang ha, what to remember, Maltese cross, kana gyud dears. Kung para gani, no, tapos na yung mga Maltese cross, naku, wag na mag-isip, wala na dyan ilain. It's your Babesia. Wala na dyan ilaing i-think. Basta mga Maltese cross, sa para, then press the buzzer, that is Babesia. Okay? Alright, sige. Alright, okay, so we now continue to the last na yun. So, tulura ko organisms, no, ito discussion for this pre-recorded lecture, pero marami-rami sila. Daming chika sa kanilang mga organisms, no? But anyway, this is the last, no? And this is your Toxoplasma gondii. Toxoplasma gondii. Alright, the Toxoplasma gondii was first discovered in 1908 by Charles Nicole and Louis Manso, whatever, at the Pasteur Institute in the North African rodent called gondii, no? So that's why yung species name kaya gondii. Okay, so yung origin. Okay, so gondii. Boys or flowers. Okay, alright. Now, again, it's part of your coccidians pa rin, no? Sporozoa, phylum Apicomplexa. And again, similar with your coccidian parasites, it is intracellular, no? Obligate intracellular oxygen parasite. And can infect a lot of nucleated cells, even your macrophages. Okay, alright. Now, okay. Your definitive host, your domestic cats, which happens, or where your sporogony happens, of course. Domestic cats, so mga cat lovers dyan, okay? And your intermediate host is, of course, man and kitapon, other mammals, where your schizogony happens. Okay, alright. Now, infective stage, same with your other coccidian, is oocyst, alright? For humans, pwede siyang yung cysts mismo from muscles, no? Later sa atong life cycle when we discuss, no? But major infective stage, actually daghan siyang infective stages, pwedeng tulo. Your oocysts, the tachyzoids, and the brachiozoids, no? So later we'll discuss that. Okay. And for modes of transmission for us humans, no, it could be the ingestion of mature oocysts. If nakuha na to siya, nakontaminate to atong hands or food ba, cat feces, ayan. From litter boxes ay yung mga cats, children's sandboxes, yes. Another method is ingestion of contaminated or undercooked meat that contains the cysts, no? The cysts of your Toxoplasma sa meat, no? And this is the most common method or common mode of transmission, most common to humans, is ingestion of undercooked meat. Okay. It could also cause transplacental, no? From baby to from mother to baby, organ transplantation, and blood transfusion. For kanina mga methods, quite rare na. Alright? But main jud, pinaka-common na mode of transmission for humans is through the ingestion of undercooked meat, okay, from cattle, pigs, or sheep. Okay, alright. So we'll go to the life cycle para mas masap time. Okay. Now, life cycle, of course, we'll start first with the definitive host, which is your cats. No, domestic cats ninyo, kanang inyong mga cat lovers dyan, okay, mga cat mama, cat papa, basta mga fur parents, ayan, mga fur parents, ayan. So be careful mo, no? Because again, for Toxoplasma, ang definitive host is your cats, no? Domestic cats, ito mga pet cats, okay. Now, in the definitive host, what happens is, of course, your cats, usually, they infect by eating, no? Kung makakaon sila o raw meat, especially from rodents like your mice, no? Mga rats, and mga birds, okay? That contains the cysts sa ilang muscles. So, dito nila makuha sa cats. Now, sa cats, ang ilang produces, of course, the oocysts. And they shed the oocysts after ingestion again of any of the 3 infectious stages. Pwedeng tachyzoids, your brachiozoids nasa tissue, sa muscles sa mga rodents or sa birds. And also even oocysts, no, from feces na contaminated. Example, food nila kay contaminated with feces that contains the cyst, oocysts. Okay, alright. Now, inside the intestine of your cats, no, the organisms again inside the oocysts, sporozoids, or tissue cysts, they invade the epithelial cells of the cat, small intestine, where they undergo the asexual cycle, the merozoids, etc., and then followed by the sexual cycle, which again, ang resulting formation is oocysts. And the oocysts are excreted in the feces of your cats. Okay, alright. Non-infective oocysts, usually 1 to 5 days pa before mature in the outside environment. So same siya with your Exosporosis, Cyclospora na hindi siya sporulated or infective when mapagawa sa environment. Diba? Unlike Cryptosporidium and Sarcocystis, na pagpagawa sa oocysts sa environment, infective na siya dayo. Diba? For Cryptosporidium and Sarcocystis. Okay, alright. Now, cats shed oocysts for about 1 to 2 weeks and about 100,000 per gram of feces. So imagine na, daghan kaayo siyang pwedeng ma-produce na oocysts. Okay. Alright. Now, oocysts survive in the environment for more than a year and are resistant to disinfectants, freezing, and drying. However, they are killed by heating, no, to 70 degrees Celsius for 10 minutes. So, it's best good, no? Later when we go to mga prevention, mga chika lang. If you have pet cats, no, example as mga litter boxes, no, or whatever, kung asa sila malibang, it's best na ang ilahang kung asa sila malibang, hindi mo siyang butangan ng hot water para at least mga bantay itong mga oocysts if na magani. Okay? Alright. Ayan. So that's for the life cycle of the cats. So ang cats, no, cats, atong pet cats, domestic cats, they ingest either oocysts from the feces sa surroundings. Pwede po nilang ma-ingest ang tachyzoids or brachiozoids from the birds nilang makaon or small rodents. Okay, now once they ingest that, again, we'll follow a sexual cycle inside the cat, and then followed by the sexual cycle. Ang end product or ilang end stage na form is your oocysts. Okay? Alright, so that's for the cats. Alright. Now for humans, again, for humans, we are just considered to be your accidental gyapon, accidental host, and pwedeng intermediate host rata. Okay, so accidental host and intermediate host kita mga humans. And 4 ways. Number 1 is again ingestion of undercooked meat. Okay, undercooked meat of your pigs, sheep, cattle that have, no, ang ilahang meat contains the tissue cysts. Okay, that contains the brachiozoids. Okay, so dito ta muna yung pinaka main mode of transmission nato, eating of undercooked meat from pigs, sheep, and cattle. Second is, of course, ingestion of oocysts, accidental from feces, cat feces. So example, if kita, nag-alaga tag cats, okay, kamo na yung mga cat lovers nila, mga fur parents, no? Example, maka-touch mo sa feces inyong cats, okay, and then natin oocyst, and then wala mo nang hinaw, you did not wash your hands, and then fecal oral, no? Ayan, that's another method. Another is mother to baby, transplacental, and second is fourth is organ transplantation. Okay? Alright, ayan. Now, once inside the human, your tachyzoids, which are again the morphological stages of your Toxoplasma, will migrate, and siya motile, siya bulikok, no? And it causes destruction in every organ. Siya migrate from one organ to another. Okay? Alright. And two forms lang found in humans, your tachyzoids and bradyzoids or bradyzoids. Because again, we don't produce oocysts. The oocysts are produced sa cats. Okay? Because the sexual cycle happens in the cats. Sa tuwa kay asexual lang. Okay? Alright, ayan. So for life cycle, para masasabdan, ang picture, ayan. So this is the original life cycle. So your cats is a definitive host. Again, inside sa muscles, sa mukhang rodents or birds, they have the tissue cysts of Toxoplasma. Okay? And kani mga birds and rodents, nakuha na po nila from fecal oocysts or kana mga, kung asa sila mukhaon ba, na ay fecally contaminated sa ground that contains the oocysts. So kung makuha na sa mukhang birds and sa mukhang bees and the bumblebees, kung makuha na sa mukhang birds and mukhang rats, of course, the oocysts, di ba, will migrate sila, whatever, and will form sila cysts sa tissue, sa muscles, no, of your birds and mukhang rats or rodents. So if makaon na siya sa imong cat, okay, na raw, of course, raw meat, so makuha nila ng tissue cysts, okay, and then inside the cat or domestic cat nimo, of course, will produce na oocysts. Now the fecal oocyst, again, pwede siya makuha sa mukhang pig or sheep, no? If makaon sila sa grass, na what if naitahin ito sa cat niyo? Okay, so, and the feces of the cat there contains the oocyst. So pagkaon nila sa grass, mapili nila kaon ng tahin, which contains the oocyst. So of course, inside the food, sa pig and sheep, similar with your birds and rats, sa ilang muscles, form of cysts ang imuhang Toxoplasma. Okay? Now, if undercooked meat, atong makaon, so pwede itong makuha. Okay? Another method is, of course, again, fecally contaminated na food or water that contains the oocysts sa atong cat, ikan sa cat. Okay? Pwede itong makaon, ayan, makakause po ng infection nato. Okay? And kanang mga, di ba na yung box nila, litter box, di ba? Litter box yung mga cat. So be careful mo ha, kanang mga tig-alagaw cats, no? Mga fur parents dyan. Usually, if yung mga cat kay naara sa sulod, no, like, dili na siya gawas, no, dili na siya maglaag-laag sa gawas, then quite safe na siya. Safe na siya from Toxoplasma. But if yung cat kay laagan, kanaganing gawas din siya, then makita nyo siya food dito sa gawas, makakaon siya rat ba or birds, then be careful, good, kay possible siya o high iya ang chance of getting Toxoplasma. Okay, so it's best if yung mga cats kay sa balay ragyo dili ra mo gawas, no, within the house na niya inyong ginapakaon kay mga canned na cat food or kanang safe ra mo na food, then okay ra. Less lang chances of your cat less chances of your cat having the Toxoplasma. But if yung cat kay laagan kay kanang mga example sa atong mga stray cats nato, no, natong ipep, pwede siyang maglaag-laag sa gasa, di ba? And then, pwede siyang makakuha po ng mga birds, mukha siya birds, or sa rats food, no? Possible high chances of Toxoplasma. And again, if di ta careful, pwede natin makuha po ng Toxoplasma from them. Okay? So, be careful lang mga fur parents dyan. Okay? Alright, ayun. Sige. So, that's for the life cycle. I hope na-gets lang. Okay, now we go now to your morphology. Starting first with the oocysts. Okay, now the oocyst, as you can see, it's similar in appearance to your eye belly. Duha ka sporocyst na sulod, and each of the sporocysts contains the 4 sporozoids. Diba? So same siya with your eye belly. Or your eye belly lang is, bakit pa iba yung shape mark? So this for isospora belly, diba? Oval niya ang shape. Duha ka sporocysts and 4 sporozoids na sulod. This is for isospora belly. Okay? So this is the oocyst, the entire thing. Kaning duha ka buo is your sporocysts, di ba? And inside are your sporozoids. So same siya appearance with your Toxoplasma. But as you can see, ang shape ng Toxoplasma is more round. Okay? Compared sa eye belly, this is eye belly na oocyst na mataas, oval. Okay? But for your for Toxoplasma, yung oocyst is again medyo round. Okay? Alright. But again, please take note ha, the oocysts, we cannot recover that from humans. Okay? Because again, asa rin makuha? Sa cats. Okay? Sa tae, sa cat, sa feces, sa mga cats. Okay? Okay. Memory, charot. Musical pa din. Okay? Cats. Okay? Cats. Okay. Alright, so that's for oocysts. Again, you cannot recover this from humans. Because again, in humans, walay sexual cycle na mahitabo. Na mahitabo ra kay asexual. Alright? So, kani siya ma-produce ra sa cats. Okay? Sa feces, sa cats. So, in humans, hindi natin makita. Okay, just me. Alright, okay. Next is your tachyzoids. Okay. So, the tachyzoids is considered to be the trophozoites of your Toxoplasma. So, siya ang butil, siya ang spread or migrate from one area to another. Okay. Alright. Now, the tachyzoids, tachyzoids, the tachyzoids again, they rapidly multiply in the intermediate host pwede kita as intermediate host or other mammals, and also non-epithelial cells of your definitive host or sa cats. Okay. Now, it is crescent shape, please take note, which iyahang other end kay more rounded than the other. Okay, so crescent shape, pero iyahang other end kay more rounded than the other. Parang ganun. What is this shape? Okay, basta crescent shape, rounded ang one end kaysa the other. Each tachyzoid contains a nucleus and is surrounded by a cell membrane. A variety of other organelles, your mitochondria, Golgi apparatus are there, but the structures are not usually visible. Stain of choice natin usually is makita, para natin siya makita is gemsa, okay? The cytoplasm is color pale blue, nucleus is red, padulong siya, or makita siya towards the broad end. So, ang nucleus hindi mo makita direct sa broad end. Okay, alright. Now, it can be transferred from one person to another through transfusion, granulocyte, no? Because your tachyzoids, as I mentioned, diba, tachyzoids sila ang buantog other organs or other areas. So, possible na ma-harbor siya sa mga granulocytes. So, through transfusion, makuha siya from one person to another. Aside from that, it's the stage of your Toxoplasma, or it's the structure of Toxoplasma that can cross the placenta. So, if a pregnant mother, ma-infect yung Toxoplasma, while nagbuntis siya, pwedeng transfer ang tachyzoids from the mother to the baby. Okay? So, ang tachyzoids ang transfer. And again, pwede po siyang organ transplantation. Also your radiozoids, okay? So, especially sa bone marrow, okay? So, radiozoids and tachyzoids pwede ma-transfer through organ transplantation, especially if bone marrow yung i-transplant. Okay, alright. Now, here's an example of your tachyzoids. Ayan, as you can see, di ba, crescent shape, medyo round ang other end. Ayan, round ang other end. Okay? And this example of tachyzoids na nasa yung acetic fluid sa mouse. Nakuha niya siya sa mouse. Acetic fluid. So, body fluid sa mouse na yung mga tachyzoids. Okay? Alright. Ayan. So, that's for the morphology of the tachyzoids. Again, consider the trophozoids or the motile structure of your Toxoplasma. Now, your radiozoids, by the name itself, di ba, tachy, ato ang prefix sa tachy or tachycardia, di ba? Kung tachy, paspas. So, in similar, tachyzoids, tachy siya ang na movement, okay? Or siyang paspas, buliho. For brady, nasa pangalan din, bradycardia. Brady meaning slow, di ba? So, bradyzoids is in a way siya ang medyo dormant stage sa yung Toxoplasma. Okay, so same appearance with your tachyzoids, but it's slow growing. Ayan. So, nasa pangalan na, di ba? Bradycardia, bradyzoids, no? Brady. So, yung mga besties mo, brad, charot. Okay, bradyzoids, ayan. So, bradyzoids, slow growing. Nasa pangalan na brady, slow. Okay. And usually, this is the structure of your Toxoplasma na mo-form of cysts within mga tissues, sa mga muscles. Nato, or pwede po sa muscles, sa imuhang mga rodents, sa imuhang mga birds, and sa mga pigs na ito ginakahon. Sa ilang meat, no? So, it's the bradyzoids that form cysts, ayan, clusters inside the host cell, especially sa mga muscles, alright? Especially muscles in your brain, in the eyes, skeletal, and even cardiac muscles. Okay, alright. Now, it cysts or becomes a cyst 8 to 10 days after entry to the host. So, di ba, example kita, no? If makakount ang oocysts, no? If makakount ang oocysts from the feces of your cats, the oocysts will become tachyzoids. Okay? Alive sila, tachyzoids. The tachyzoids will migrate from one organ to another. Now, let's say ang tachyzoids kay ang iyahang area or environment kay dili na conducive. So what happens, the tachyzoids will now convert to the bradyzoids. And the bradyzoids again, siya ang mas prevail, siya mas madugay, or siya ang mas live longer. Siya makasurvive sa imong mga harsh environment because again, may cyst siya sa imong muscles. Okay? Ang bradyzoids, okay, the bradyzoids, siya ang form of cysts within your muscles. Not only in humans, but also in mga rodents, di ba? Sa pigs, sa sheep, okay? Sa ilang mga meat, okay? Basta ang makaon nato is ang oocyst, okay? From the feces, okay? Gets lang? Alright, ayan, sige. So again, ayan, so they are the only stage that can transform again as cysts sa imong muscles. Okay, alright, ayan. Next, you have the cyst, again, may contain to as few as 50 to several thousand of bradyzoids. So, ang sulod sa usa ka cyst kay mga bradyzoids. So, na yung mga bradyzoids sa sulod. Okay? So, later na yung picture na. Okay. Now, again, they are formed in chronic infections. Again, usually sa chronic infections. And organisms within the cyst wall are strongly positive. Okay. Alright. Now, pseudocysts are a group lang of tachyzoids that can be mistaken as bradyzoids, pero tachyzoids ang sulod. Okay? So, pseudocysts, but they are not bradyzoids, but tachyzoids. So, difference lang kaya they are not strongly positive. Okay, alright. Now, intact tissue cysts, because again, they are within muscles, parehas na to, di ba, as mentioned. If makakaunta sa oocyst from the feces of your cats, okay? So, the oocyst will convert to tachyzoids. Tachyzoids will move from one organ to another. And once the environment is not conducive or once sa muscles, they will become bradyzoids. And the bradyzoids will form cysts within our muscles, no? So, pwede siya persist for a longer period of time, no? Persist siya for many years. That's why ang mga cysts that contain the bradyzoids, they are the ones that cause chronic infections, okay? And most of the time, they do not cause any inflammatory response, okay? Because again, they're just dormant, no, living within your muscle tissues. Provided again that your immune system is again well functioning well, and it's intact. So once your immune system is okay, it's not weakened or compromised, then these tissue cysts will not cause any inflammation or symptoms. Okay, alright. So here's an example of your bradyzoids. Ayan. So these are the cysts as mentioned. So these are bradyzoids inside. So the whole thing is called the cyst. Okay? And again, usually musulod din sila sa mga muscles na to, especially sa skeletal and brain. Okay? Ayan. So here's an example. This is a cyst found in brain tissue. Okay? So ang sulod sa cyst ay mga bradyzoids. So nasa pangalan na tachy, siya ang motil, siya ang paspas, no? Siya po na multiply sige, no, sa imuhang body. Your brady or brady, di ba brady is slow, ang imuhang prefix meaning. So para sa bradycardia, tachycardia, di ba? So bradycardia, bradyzoids, siya ang slow growing, siya ang form of cysts within muscle tissues. Okay, alright.
Alright, okay, so we now go to the disease proper. So again, review lang, no, baka na-confuse. Okay, so for humans, we can get Toxoplasma, di ba, 4 ways, no? Pero ang pinaka-common na to is from ingestion of undercooked meat, such as pig or such as pork or sa sheep or sa cattle that contains the cyst within the muscles, di ba? Recall, di ba, pwedeng mo create og cysts imuhang Toxoplasma in the muscle, okay? Now, di ba, these cysts are usually formed if makaon sa imuhang pigs, no, sa imuhang mga sheep, sa cattle, ang feces gikan sa imong cat, okay, that contains the oocyst, no? So inside the intestine of your pigs and sheep, diba, mo gawas ang tachyzoids, etc., and then mo forms like tachyzoids, diba, and then mo spread to the organs, and then once inside the organs, mo insist imo ang tachyzoids and they form the bradyzoids or bradyzoids, diba, and muna sila mo insist sa tissue sa imuhang mga pigs and sheep. Now kita as humans, pwede natong makuha to siya by eating undercooked meat, diba, and pagkaon na to ana, of course, ma-digest tong bradyzoids, mugawas sila. So it can cause infection. Another way na to is if makakaon gyud ta sa oocysts from the feces of our cats, especially if you are taking care of cats, if you have pets na mga cats, okay? So pwede na to siya makuha from there. So muna siya mga ways niya. Okay? Alright, ayan, sige. So when the tachyzoids, as mentioned, sila man yung mga mo proliferate, sila ang active, no? Sila ang paspas, sila ang mulihok. Once mo infect siya, okay? Once it goes to other organs, it causes what we call focal lesions. And please take note of that, ha? Mga lesions, focal lesions. So, as mo move siya from one area of the organ to another, no? And mo invade sila mga cells adjacent to the original infection. Kung asa sila gikan, o kung asa sila nag-start to infect, mo cause sila og lesions, okay? Focal lesions, or mga samad-samad. Okay. Alright. Now, once the cysts are formed, so inside the muscle, diba, the tachyzoids, or inside the organ, inside the muscle, they become cysts, no? And inside the cysts are your bradyzoids or bradyzoids, okay? All right. No, once they are cystic na or nanay cysts na form, the cysts are not active anymore, no? So little or no multiplication and spreading happens, okay? The organisms, however, can be disseminated via lymphatics and your bloodstream to other tissues. So, gikan sa intestine, no, pwede siyang spread via the lymphatics and your bloodstream to other tissues and other organs. Okay, all right. So, that's for the introduction to your toxoplasmosis. Okay. Alright, ayan, sige. Okay, take note ha, focal lesions. Alright. Now, your disease, again, ato siyang divided into 4. The first one is disease in the immunocompetent. So, again, if you're functioning well, your immune system is okay. Again, this disease is generally self-limiting and walay clinical symptoms usually. However, 10 to 20% will exhibit symptoms, pero the acute infection ng mga symptoms usually contains lang painless na lymph adenopathy and pwedeng flu-like na mga illness. So, dili kayo severe ang symptoms. Presentation again is self-limited and can resolve within weeks to months. Acute visceral manifestations, meaning naabot siya sa organ or like na yung mga intense symptoms inside, visceral manifestations, rare lang siya mahitabo. And most infected patients remain asymptomatic, okay? Or ilahang na experience kay murarag common cold. So, if your immune system is working well, again, if na kay mga cysts, no, sa imuhang muscles, kay basi nakakount kag cyst ba, gikan sa feces of your cat, usually these cysts within your muscles, they do not cause any infection or wala ray inflammation or wala symptoms. Again, if immunocompetent ra ka, okay? And majority na yung mga cases yun nakita, no, ambulatory lang, daghang mga people put there that contains cysts in their muscles, no, of Toxoplasma. But again, they do not feel any symptoms or any infection because again, okay lang immune system. Okay. Now, it's obviously the opposite, very much the opposite in the immunocompromised, no? So, severe complications, very severe complications. So, underlying conditions that may predispose the patient to severe infections or symptoms are those patients that contain the Hodgkin disease, non-Hodgkin lymphomas, leukemia, solid tumors, collagen, vascular disease, organ transplantation, and of course, AIDS. So, kanina mga diseases, of course, it will render your immune system non-functional or weak, no? And once that happens, pwedeng mo severe ang symptoms nato with Toxoplasma. Now, in the immunocompromised patient, usually ang target is the brain, okay? So, CNS ang primarily target if immunocompromised, okay? But aside from that, pwede pong ma-affect ang heart, which could lead to myocarditis or sa lungs, no? Pneumonitis. Okay. Now, transplant recipients, those that are receiving organs, no? For transplantation, the disease presentation depends on exposure to T. gondii by the donor and the recipient, the type of organ involved, and the patient's level of immunosuppression. So let's say, ang nakuha ni mo na organ kay katudjong medyo mo elicit gid og immune response or pwedeng possible na daghan kaayong cysts sa Toxoplasma inside and then makuha sa patient na mo dawat and immunosuppressed pag siya, so pwedeng mas mo severe. So dito siya mo depend ang level of disease or level of infection caused by Toxoplasma sa mo receive sa organ. Okay, depende sa organ I receive. Again, bone marrow, medyo intense, no? Medyo daghang bradyzoids na pwedeng makita dito or pwedeng intense ang symptoms. Level of immunosuppression sa patient na mo dawat, if intense gyud ang iyang immune system na pagka-suppressed, pwedeng intense ang symptoms. And exposure to T. gondii. Let's say if chronic infection na sa imuhang donor ang iyahang T. gondii, chronic na gani, then of course, possible na daghan ng cysts na na-form that contains the bradyzoid. Hence, ang mudawat sa organ, okay, possible po na intense iyahang symptoms na ma-feel. Okay? So, muna yung mga dependent na mga factors sa mga organ transplant recipients. Now, for stem cell transplant recipients, ang particularly susceptible, so those that are mga stem cells, no, gikan sa placenta ba, umbilical cord, or sa bone marrow, mga ganun, basta mga stem cells, alright. Because, usually, naadiri ang mga latent, no? Latent na mga bradyzoids or mga cysts na natulog for a long period of time and then pwedeng ma-reactivate pag transplant to another patient. Ayan, so that's for transplant recipients on organ transplantation. Okay. Aside from that, AIDS patient, of course, cerebral toxoplasmosis or also known as Toxoplasma encephalitis. So Toxoplasma encephalitis before was one of the major opportunistic infections na ginalook after sa mga patients with AIDS. But now that naanay mga HAARTs, highly active antiretroviral therapy, medyo na-lessen na ni siya because again of HAARTs. Okay, alright. Now again, first apparent clinical symptoms usually of AIDS may be that of CNS, and it's usually caused by again T. gondii. Alright? Now once the T. gondii organisms kato mga cysts that contains the bradyzoids kaya na nasa brain, they will be confined within the CNS. And of course, because it involves the brain, of course, very life threatening na siya. Okay. Respiratory disease has also been associated or recognized. Pwede po siyang mabot sa imuhang lungs. Alright. And disseminated toxoplasmosis should be considered in immunocompromised patients that are culture negative sepsis, no? Iyahang results kay iyahang culture kay negative, and naa siya mga neurologic, respiratory, or mga skin lesions. So if ang patient, AIDS patient na exhibit og mga neurologic, respiratory, or unexplained lesions, plus culture negative pagid siya, then toxoplasmosis can be must be considered. Okay? And also if ang patient is a liver transplant, no? Liver transplantation liver transplant recipient, no, and nagka-multi-organ failure siya after liver transplant, then the possible suspect po is toxoplasmosis. Okay? So liver transplant and then nagka-multi-organ failure, then possible na toxoplasmosis ang agent ato. Okay? Alright, ayan, sige. So that's for the immunocompromised. Okay. Next, you have, of course, very important, the congenital infections. Because we have mentioned that the tachyzoids of your toxoplasma can cross the placenta and of course can cause infections to your baby, to the fetus, no? So it's a transfer of the parasites from the mother to the fetus when the mother acquires a primary infection, no? During pagkabuntis niya, nahawaan siya or nakakuha siya ng toxoplasma na agent. Diba? That's why your toxoplasma, unsa na ito mnemonics for congenital infections, unsa to siya? Na-mention na sa first part pa lang sa lecture, you have, of course, the torch agents, diba? Torch. TO stands for, of course, Toxoplasma, nasa pinakauna. R stands for rubella, don't forget ha, rubella, dili rubiola. C for CMV, and H for herpes viruses. And again, among these agents, kinsay pinaka-common, the most common cause of congenital infection, wag na maisip, press the buzzer, it's CMV. Okay? Siya ang pinaka-common. Okay? Pinaka-common ang CMV. Alright? Okay, but again, torch. So sila ni mga maka-cross sa placenta, maka-cause of infection while the baby is still in the in the uterus. Okay? Ayan. So toxoplasmosis, because your tachyzoids can transfer from the mother to the baby through the placenta. Okay. Alright, ayan. Or through the placenta, tama. Okay, so primary infection of the mother, usually. 90% of the patients walay symptoms. Alright? But if naman gani symptoms, later, well, no, so itong mga symptoms niya. Now, it can be severe if first or second trimester of the pregnancy. Usually, in pregnancy, di ba, first and second trimester ang pinaka sensitive, no, and pinaka critical, ayan, because any changes or any mga diseases or mga harmful substances, if dira gi-take sa mother, intense ang effect ana sa baby, no, possible na yung mga mental retardation, mga defects sa body, no, mental defects pod. So first and second trimester good ang medyo critical sa pregnancy. Okay, and if na-happen ang infection sa toxoplasma ana na trimester, then of course it can lead to intense na mga defects. Okay, now at birth or pwedeng after pila ka years after birth, it may include retinochoroiditis, so meaning na inflammation sa retina, sa choroid sa retina, cerebral calcifications na yung mga lesions na ni-calcify, no, ni-gahi sa brain. Okay, hydrocephalus, gamay na ulo, ay dako na ulo sorry, or microcephaly. Aside from that, pwede po na the baby can be stillborn, pagpanganak, or abortion po, pwede miscarriage, no, because of toxoplasma. Okay, so symptoms of congenital CNS involvement may not appear until mga pila ka years later po. Alright, okay. Characteristic symptoms, again, hydrocephalus, don't forget ka na mga keywords ha. Hydrocephalus, cerebral calcifications, retinochoroiditis or chorioretinitis kana sa eyes. Okay, results in mental retardation, epilepsy, and impaired vision. And this is, again, most severe forms imuhang congenital infection. Okay, alright. And in the case of seroconversion, or let's say ang imuhang mother kay nagka-create og antibodies against Toxoplasma, meaning na-infect siya, we then test the amniotic fluid. If nagbuntis pa ang patient or nagbuntis pa ang mama, no, itest na to iyahang amniotic fluid to check for antibodies against Toxoplasma. Okay, alright, ayan, sige. That's for congenital. So, take note ha, take note. Mga keywords na to, cerebral calcification, retinochoroiditis, no, hydrocephalus, inana. Kaya may mga questions sa boards or sa inyong review na retinochoroiditis, cerebral calcifications in infants or in babies or in fetus, yes, or mga babies, can point to what organism or can point to what infection? Press the buzzer, Toxoplasmosis. Okay, mga retinochoroiditis, again, imuhang, so to cerebral calcifications, ayan. So, kanato mga key terms. Okay, alright. Next, of course, another type is ocular infections. Now, ocular infections, again, it targets the retina. Chorioretinitis or retinochoroiditis. So, same na sila. Chorioretinitis, immunocompetent, if immunocompetent ra siya, okay ra yung immune system, it could be due to a past congenital infection. Kung chorioretinitis, sa immunocompetent. Okay. Patients may be asymptomatic, then mo develop na siya mga second or third decade. So, mga 20 or 30 years old na nimo. Okay. Now, chorioretinitis is bilateral if congenitally acquired pag yun siya, pagkabata pag yun, or pagpanganak nimo, nagka-toxoplasma si mother nimo while napaka-sa-feet sa iyang uterus, and then pagpanganak, wala pa nigawas ang symptoms, and then after pila ka years, dito pa lang, chorioretinitis ang nigawas. So, if ang chorioretinitis is congenitally acquired, it's bilateral, so 2 eyes. But if recently acquired ra, imuhang Toxoplasma, and then ang imuhang Toxoplasma kay naabot sa eyes, okay, katong mga cysts ba, naabot sa eyes, imuhang retina, unilateral lang, usara ka eye. Okay? Usara ka eye ang naay chorioretinitis. So, here's an example of your retina. Kaning dako here, yes, that is the lesion that is caused by your tachyzoids also. And tachyzoids, no? So, niabot sila sa eye. Diba? As mentioned, ganaan po sila sa eye na tissue. So, sa retina. So, that's an active lesion of caused by Toxoplasma, chorioretinitis. And this part is the healed, no? Healed na siya na chorioretinitis. So, pila na ka-years na ayon na siya. Okay? So, chorioretinitis. Again, once the tachyzoids, alright, ay naabot na sa imuhang retina. Okay? Alright, so that's for Toxoplasmosis. Okay? So, take note ha. So, tachyzoids, diba? Once mo spread siya from one tissue to another, it causes lesions. So, na yung mga questions dito na multifocal lesions. Ayan, please take note. Multifocal, focal lesions, no? Multifocal, focal lesions. Ayan. In the brain ba or in the heart, whatever, found in AIDS patient. Naku, wag na mag-isip, it's for, that is Toxoplasma. Okay? Alright, ayan, sige. So, that's for Toxoplasma gondii na disease. Okay? So, daghan, possible. Kung immunocompetent ragod ka, you're fine, you're okay, no? Kaya most of the time, you don't feel any symptoms, but you have it. Because again, your immune system can keep it under control, ang imong organism. Pwede rin niyang mapatay, no? Pwede rin niyang masuppress ang imuhang Toxoplasma organisms if your immune system is working properly. But if you're immunocompromised, ayun, marami na, no? Especially sa mga AIDS, no? It can involve the brain, no? Congenital infections. It can also be transferred from the mother to the fetus via the placenta. Your tachyzoids can move from the mother to the baby via the placenta. And of course, ocular infections, no? Chorioretinitis. Kana ang mga terms na to, dears, no? Na very kanang distinct or kanang press the buzzer na to for Toxoplasma. Kanina mga terms, chorioretinitis, cerebral calcifications, retinochoroiditis. Retinochoroiditis, chorioretinitis, same rin na sila. So, chorioretinitis, cerebral calcifications, multifocal, focal lesions, okay, very important. So, kana sila mga Toxoplasmosis ang gipasabotana. Okay? Alright, ayan. Now, we go na to diagnosis. Ayan. For diagnosis, of course, atong main test or main method is through serology. Ayan. That's why it's important that we discuss with this because the main method na to is through serology. Okay? Because ang demonstration sa parasite, usually, it's invasive. Because, di ba, usually makita siya sa imong mga tissues, no, sa muscle. So, we need biopsy pag yun. So, inana. So, it's not inana ka patient-friendly na way or dili siya convenient. So, ang pinaka-best gyud and the recommended method or diagnostic approach of choice is serological test. Ayan. So, we detect again T. gondii specific antibodies, and the double sandwich ELISA method is the recommended method for detection of IgM antibodies present especially in congenital infections. So, kani mga serological tests very very important especially to congenital infections. Ayan. So, if ang titer is greater than equal to 1 is to 256, then that's significant, seen in the first 4 months of infection. So we detect IgM usually for, again, congenital infections sa baby. Okay, so we test the sample of the baby, right? We look for IgM na antibodies. But again, the one sample of IgM na positive sa usa ka baby, it doesn't really point to the infection. So we need to test further pag yun, no, after pila ka days or after pila ka weeks to look or to confirm if it's really Toxoplasma, kay possible lang na false positive na to siya. Okay? Alright. But again, double sandwich ELISA method atong recommended method of choice. And aside from that, we can perform the IgG avidity test. Ayan. Because again, this is performed to determine whether the IgG antibodies are from a recent or a previous infection. Diba? Recall in your IS, basic na to ng mga IS, the meaning of avidity. Avidity is the sum of the total forces, diba, between an antigen and antibody na combination. Okay? Now, if the avidity is of course higher, it means that your antibodies or the infections have been going on for a longer period of time because dugay naman nahitabong infection, no? It's been going on for a long period of time na. It could mean that ang mga antibodies na na-produce are already kanang stronger, no? Mas higher na iyang capability to react with the antigen. Therefore, mas taas ng avidity. Because again, it could mean that dugay ng infection. It's been happening na. So your body has already been fighting this infection for pila na ka-day, pila na ka-years, or chronic na ni siya. So it means that iyahang antibodies na na-produce na, and yung mga mutations na na-produce sa imong antibodies, so mas strong na yung avidity, mas kusog na siyang mo-atake sa imong antigen. That's why if presence of high avidity IgG, it indicates a past infection. Pero kung present of low avidity pa lang, bago pa lang siya, low avidity, so medyo weak pa yung antibody, di pa yung naka-strong ang bonding between your antigen and antibody. Therefore, this is just a recent infection pala. Okay, nagets lang? So, avidity, di ba? Avidity is the sum of all the total attractive forces between an antibody and an antigen. So, if taas ng avidity, it means that, again, the infection has already been going on for a long period of time na. Because again, that could mean that the body has been fighting off this infection for pila ka years, no? Or for a long period of time na. Hence, the antibodies that are produced or the immune system is now primed, okay? Or mas ang immune system, the B cells na mo-produce antibodies are now producing antibodies that of higher, no, avidity, no, higher strength na against the antigen. Kay dugay naman. So murag naanad na ang body nimo ba na ay kanina pud siya, sige, okay, sige, mas intense na kabalo na imong body na kanina pud sige, kanina antigen for the longest time na gyud or for pila na ka days, years, or whatever. So, of course, ang antibodies na ma-produce, medyo higher strength na gyud, higher caliber na, ganun. So, higher avidity indicates past infection, gyud, and low avidity meaning bago lang pa siya. So, nagsugod pa lang na infection or recent infection siya. Kay low avidity pa lang. Okay. Alright. I hope na-gets na to siya, dears. Okay. Alright. Ayan. Okay. So, we now look into this summary, no? This is from Stevens, yes. Ako mga IS students dyan last sem, sana na-remember pa to. But anyway, no? So this is a summary of the results, no, sa atong antibody test, IgG, IgM for Toxoplasma. So as you can see, IgG, if both of them are negative, of course, that points to a no infection with Toxoplasma or no serological evidence na the patient has Toxoplasma. Kaya negative man ang both IgG and IgM. Next row, if equivocal ang IgM, when I say equivocal, the result is not clear, no? It's ambiguous. It's not clear kung positive ba or negative. But but IgG is still negative, so this could be considered a false positive na IgM or early acute infection pa lang. So what we do is we repeat testing. If the result is still the same, then possible na false positive lang ang IgM. Okay, next, if positive ang IgM pero negative ang IgG, that could point to an acute infection or again possible na false positive. So repeat testing gyapon, and if the result is positive niya, negative siya po ng IgG, it could be that false positive ang IgM. Because in acute infection, possible na nanay IgG ginagmay. Okay? So, dili siya man-negative yun in a way. Alright. Now, IgG equivocal, IgM is negative, indeterminate. So, we need to retest using a new sample. Okay? Using a different assay. Next, equivocal ang duha. Walay klaro, no? So, indeterminate gapon. Recollect or perform another test or another assay. IgG is equivocal, IgM is positive. So, equivocal meaning medyo dili klaro ang results sa IgG pero positive dyan ang IgM. That could point to an acute infection at this time. So, we need to obtain a new specimen and then perform. If the sample is still equivocal for IgG and positive for IgM, then we need to send that to a reference laboratory. Okay? Or mo positive na ang IgG, send to reference laboratory gapon para mas sure. Now, if positive ang imuhang IgG, negative ang IgM, then of course, that's a past infection. Okay, positive sa IgG. It could mean 6 months or longer na. Pwede chronic infection ang imuhang patient. Positive for IgG, negative for IgM. Positive for IgG, equivocal for IgM. So that could mean more than 1 year na imuhang infection with Toxoplasma or false positive gyapon ng IgM. Okay, alright. Now, obtain a new specimen for IgM testing. If same na gyapon ang result, positive ang IgG, equivocal ang IgM, send the samples to your reference laboratory para mas sure yun siya. Okay, and the last, if both of them are positive, then that could indicate recent infection within the past 12 months or pwede po false positive Japan for IgM. So, it's best pa rin to send the specimen to the reference laboratory for testing. So, as you can see, no, even if serological tests are the recommended method to diagnose or to detect Toxoplasma, there's still some difficulty, no, in interpreting the results. So, it's best na if dili mo sure sa pag-interpret or if dili pa established in your laboratory or sa inyong SOPs, ang pag-report sa inyong Toxoplasma na serological results, it's best to send that to the reference laboratory. Okay? So, this is for gikan ni sa Stevens. Okay? Nato na book sa IS. Yan. Ako mga IS students dyan. Sana na-remember pa to. Okay? Alright. Next, another method is your Sabin-Feldman. Ayan. Sabin-Feldman dye test. This is a crude and one of the early methods, no? Serological methods to diagnose your Toxoplasma. So, Sabin-Feldman dye test is considered to be the gold standard test for the IgG antibodies against Toxoplasma. So, the principle is complement-mediated neutralization. Ayan. So, what happens? Ang principle nato is, we obtain a patient sample, okay? And we incubate the patient sample, patient serum with live tachyzoids. So, this time, kanina siya na test, we need live tachyzoids. So, coming from animal culture ba or whatever. So, medyo costly siya, no? But anyway, so muna siya. Ato siyang incubate ang imuhang patient serum with live tachyzoids. Okay. Now, after a while, ada nato siya complement. Okay. Now, let's say the patient has antibodies against Toxoplasma. So, of course, ang tachyzoids, ano na lang ha, sorry, ako mga dares drawing. So, of course, if the patient serum has antibodies, of course, mutapot siya sa imuhang tachyzoids, di ba? Now, na may complement, so of course, recall, di ba, complement system is initiated once there is antigen-antibody combination, di ba? One of the ways para ma-activate ang complement is the presence of antigen-antibody combination. So, now na may antigen-antibody combination, so mo-attach ang complement, di ba? So, what happens man? Unsa may end product sa complement system? Cell lysis. So, what happen is, mulyse ang imuhang mga tachyzoids, di ba? Mulyse ang tachyzoids. Sorry, dear, ang pangit talaga ng drawing ko. Ayan. Lyse ng tachyzoids. So, what happens? Pag add mo sa methylene blue na dye, lyse naman ang imuhang mga tachyzoids. So, of course, dili na nila unsa may mahitabo. Lyse naman ang tachyzoids. So, cannot be absorbed ang imuhang methylene blue. Therefore, ang imuhang tachyzoids will remain colorless. Ayan. So, I hope na gets ra. So, therefore, colorless, that indicates a positive result for patient antibodies to Toxoplasma, which could indicate that the patient also had experienced or has a Toxoplasma na infection. Gets? Because again, di ba, your patient serum is incubated with live tachyzoids, and if the serum contains antibodies to tachyzoids, so mo-attach siya, no? And then na may complement, so mo-attach ang complement sa antibody-antigen complex, no? So ma-activate ang complement, ma-lyse ang tachyzoids, therefore pag-add sa methylene blue, which is your dye, okay, na-lyse naman ang tachyzoids, dili na nila ma-absorb, okay, or dili na ma-retain ang methylene blue sa tachyzoids. Hence, the tachyzoids will remain colorless, okay? And that indicates a positive result. So, let's say if negative ra, no? Negative ra ang imuhang patient, So tachyzoids, no? So ada ni mong serum, pero this time wala siya antibodies. So therefore, imuhang complement po nag-i-add, kani mga complement diri, wala siya lyse, diba? So the tachyzoids remain intact, no? So pag add mo sa methylene blue, ma-absorb na nila. Kay complete intact naman ang tachyzoid. So once ma-absorb nila, of course, the tachyzoids will be color blue. And that indicates a negative result. Okay? Because again, wala may antibody ang patient serum that could have activated the complement para ma-lyse ang tachyzoids. Okay? That's seen in the negative result. Okay, nagets ra? I hope nagets lang. Okay? Di ba usually ba sa mga complement mediated, di ba? Complement fixation ato ng mga test, ang opposite gyud is usually no color, no hemolysis, di ba? Remember sa atong IS gyapon, ayan. So that's for the Sabin-Feldman dye test. So here are the results, no? Ayan, lyse tachyzoids, of course, dili nila ma-absorb ang color blue, methylene blue. So positive ang patient sample with Toxoplasma antibodies, okay? And tachyzoids absorb the dye, so ayan, color blue sila. So therefore, again, negative ang patient sample with antibodies to your Toxoplasma. Okay. Now again, this method, although again, it's the gold standard test for IgG antibodies, you need live tachyzoids, diba? And again, you get live tachyzoids from usually mga mouse, live animals, no? Animal culture, ganun. So it's not performed routinely in the routine labs sa hospitals, because again, you need live tachyzoids, no? Ayan, so it could be costly and very technical then. Ayan, but again, this is the Sabin-Feldman dye test. Okay, all right. Now we go na to other methods. Ayan, PCR, of course, biopsy specimens from our muscles, diba? Kay possible na na mga tissue cysts dira sa atong mga muscles. Buffy coat prep, pwede po, kay pwede siyang mga tachyzoids makita sa macrophages, no? Or CSF, and of course tissue culture or in animal culture. Okay, antigen detection, it still lacks sensitivity when used with human samples. May be helpful though in immunocompromised patients if their antibody titers are low, because again, immunocompromised, so possible na gamay na lang na antibodies lang ma-produce, or dili na function ng ilahang B cells to produce or plasma cells to produce antibodies, no? So pwede ta mo detect og antigen, okay, sa imuhang Toxoplasma, but again, lacks sensitivity pa, so that's why it's not yet routinely used. And aside from that, histological preparations or isolated in animals, if maka-isolate ta usually, it may not be the causative agent of symptoms, because again, as I've mentioned, if the patient's immune system is working properly and it's functioning well, kato mga tissue cysts sa iyahang muscles, no, possible lang na dili siya mo cause og infection, di ba? So if makakuha ta og inato sa histological preparations nato, sa histotechnology or biopsy, whatever, possible na dili siya mao ang cause, no? But in cases lang na example, gikan gyud siya sa brain, no, or gikan siya sa lungs, niya respiratory ang symptoms, and then immunocompromised ang patient, then press the buzzer, possible Toxoplasmosis gyud to siya. Okay, but in immunocompetent na mga patients, individuals na okay ra gyud immune system, possible na dormant stage na to siya again, and it's not the one causing the symptoms. Okay, diba recall, humans can get Toxoplasma from, again, ingesting the oocysts from feces, or pwede po siyang gikan sa meat, no, undercooked pig, undercooked meat, no, undercooked pig, pork, no, or sheep ba, or cattle that has the cysts that contain the bradyzoids in their muscles, no, in their meat. So pag makaon na to siya, of course, ma-digest na to, mugawas to mga bradyzoids, mo infect. Okay, but if ang oocyst atong makaon, possible na ang oocyst pareha siya sa mahitabo sa mga pigs ba, or sa mga sheep, na if makaon na to ang oocyst from the feces of your cat, mo-form po sila og mga tissue cysts sa ato ang muscles. If makaon na to accidentally ang oocyst from our cat feces. So prevention na to, that's why it's best again to cook your meat properly, no? Dapat ka na yung inside po is cooked, no? It's well cooked. So be careful lang ang mga tingkaon, mga rare, no, mga steaks na to na rare, medium rare, mine ana very very scary. Ako ana personally, knowing na I'm a medtech na kita medtechs, kabaluta sa possible diseases na makuha if undercooked ang meat, no? So very scary. Kaya mukha na ganun kung kinilaw na fish, sometimes kay mahadlok na pugko, pero lami mang good, so masarap ang bawal. Diba? So careful lang Japon. But again, if immunocompetent rata or immune system is working properly, then less likely na mo exhibit og symptoms or magka-severe ang infections. And aside from that, if you are again a fur parent, especially mga cat lovers dyan, make sure lang yun na your cats do not dili sila katong laagan na cats. Okay? If laagan sila na cats, if malibang sila, no, make sure lang na dili mo makontakt sa feces. If nasa like ka ng kalibangan, no, like kana nasa like mga litter box as mentioned, kana litter box or children's sandboxes na pwedeng malibangan nila or dito sila mo defecate, make sure lang na you dispose the stool properly, and then ang butanganan, the box, you put hot water, no, para again because your oocyst can die in hot water, di ba? So or in high temperature. So it's best good to be careful. Mga fur parents dyan ha, mga cat lovers, be careful. Alam nyo na, possible Toxoplasma gondii. Okay? And if you have also mga pregnant people in your house, no, na may mga pregnant sisters, mothers, or mga titas ba, it's best that you prevent them from being in contact with the cats, no? Because again, of possible Toxoplasma, no? Toxoplasma infection. And because as we have already known, your Toxoplasma can cross the placenta and cause infections in the baby, in the uterus, diba? So, possible severe infections, diba? Mental retardation, cerebral calcifications, no? Retinochoroiditis, chorioretinitis. So, very important, no? And again, for pregnant women po, it's best good to eat mga well-cooked meat, diba? Okay, that's another way of another way of getting Toxoplasma. Okay? So that's for Toxoplasma gondii. Torch, no? Part of the torch agents, multifocal lesions, do not forget, multifocal lesions, cerebral calcifications, retinochoroiditis, chorioretinitis, mga muna siya itong mga press the buzzer na mga terms. And again, definitive host, atong mga cats, atong mga queen, atong mga queen na mga cats, yes, mga, kanon sana, ang mga unbothered nato ng mga pets na cats, yes. And of course, intermediate host rata. Daghang ways natin pwedeng makuha. Ingestion of undercooked meat, ang pinaka-common. The meat contains the cyst that contains the bradyzoids, okay? Second is, again, fecal oral, accidental na makuha nato siya from the feces of the cats that contains the oocyst, no? Pwede nato makuha. Another is congenital, mother to fetus, and pwedeng organ transplantation, okay? So that's for Toxoplasma gondii. Very important, method of choice for diagnosis, serological. Okay? And Sabin-Feldman dye test positive for antibodies. Again, the patient, the tachyzoids is colorless because na-lyse siya sa antibodies found in your patient's serum. Diba? Na-activate ang complement. And of course, negative for antibodies, the tachyzoids absorb the methylene blue, hence they appear color blue. Okay? Sabin-Feldman, please take note. Alright, okay, and that's the end. Yes, that's the end of our lecture on the Sporozoa. So I hope nakagets from mo, dears. Medyo madami siyang chika, although gamay ratong organisms, di ba, nagi-chika, tulura ka buok, pero dagan kayo silang mga chika. And these are some of the most important po na mga parasitic diseases, malaria, babesiosis, and toxoplasmosis. Especially from the protozoa. Kani sila ng mga protozoan infections, usually ang one of the most important na mga infections. Okay? Alright, so I hope na-gets from mo, dears. If you have any questions, I hope lang yun na-gets from ninyo, no? I hope lang po na-effective ratong lectures. Medyo kapoy na yun siya, dears, pero laban lang ta. I hope lang yun na na-learn. No? If you still have any questions or clarifications, feel free to PM me, chat me, no? Don't worry lang yun. I'll try my best to answer those questions. Okay, so thank you for watching, and I hope to see you in our next lecture. Hopefully synchronous na. Okay? And again, I'll see you there in the next lecture. Keep safe. Thank you again for watching, and have a great day. God bless.